I'm Michelle. I'm a recently graduated medical student from Montreal, Canada, and I'm here as a part of the organizing committee of IFMSA's Youth PreWHA Health Assembly. We're here at the Palais des Nations in the United Nations in Geneva because in this moment is held the World Health Assembly, which is the biggest global health event of the year. IFMSA has a delegation here each year, and I'm here with some delegates of our federation that I will let introduce themselves.
Hello everyone, my name is Ahmed. I'm a medical student from Egypt.
Hi, I'm Rahba, a medical student from Sudan.
Hi, I'm Mukshita and I'm a recently graduated doctor from India.
Hi, I'm Emily and I'm a chiropractic student from Belgium.
So during the World Health Assembly, it's the moment where countries gather here at the World Health Organization to discuss different global health issues, along with non-state actors like IFMSA. And we organize actually a pre-World Health Assembly to prepare our delegation of around 50 people to be better advocates here and to better talk about global health as a whole, you know, in different angles, not only about the clinical aspect, but also the political, economical aspect, etc. So maybe let's start with Ahmed. Would you like to share your experience in your advocacy small working group here at the pre-World Health Assembly?
Yes, absolutely. So I was privileged to be part of the PreWHA Health Assembly this year, and I was more privileged to be a part of the Human Resource for Health Advocacy Working Group, which is one of my biggest concerns in life. I was really privileged as well to be introduced to a couple of great externals from the World Health Organization and the International Labour Organization, who introduced us to the shortage the world facing nowadays in the health workforce, and how the World Health Organization is planning to tackle this problem. But more importantly, we learned how we as youth can be engaged in this action plan.
Yeah, that's a very good point that leads us to what Rahba wanted to share with us. Just to put you in context, IFMSA has two priorities this year here in Geneva, which is meaningful youth participation in global health and universal health coverage. So what did you learn about the role of youth in global health?
Yeah, well, so as youth, we're constantly told that we are the future, but during the pre-WHA and WHA, we've actually been constantly reminded that we are working in the present, trying to shape the future. And actually, I've heard a lot of, although I have heard a lot of sad stories on countries not being able to implement the health policies that they've put forth, I've also heard a lot of inspiring stories of countries, especially in Africa, that have been able to make a change and improve health in their countries. And I think that has inspired me to go back to my home country and work at a local level so that our voices as youth can be heard at such huge global arenas such as the United Nations.
Thank you for sharing. And Mukshita, tell us a little bit about what you learned regarding universal health coverage from different perspectives than the one we learned in medical school.
Thank you, Michelle. So during the WHA, pre-WHA, we had the opportunity to learn from experts about a lot of other arenas, not just the clinical aspect of medicine. And I also had the opportunity to work in the UHC Advocacy Working Group, in which it was really valuable to hear about how politics affects finances and how health economics is such an important factor to keep in mind when we're talking about universal health coverage and implementing that within our member states.
Yeah. Thank you. And last but not least, Emily is a chiropractic student. So would you like to share with us how important multidisciplinary actions is in global health?
Yeah, first of all, I really want to commend IFMSA for including so many non-medical students into their delegation. There was me as a chiropractic student, but we also had students from the fields of dentistry, nursing, veterinary, and pharmacy. And not only was it great during the pre-World Health Assembly to have so many different opinions and perspectives when we were having discussions, I think it also sets the tone for the future for healthcare in general, because when we're working with patients, they always have more than one thing going on, and so our approach needs to be multifaceted and interdisciplinary. So I really think it sets the tone for the future.
Yeah, thank you for sharing. So concluding this discussion, if you could describe the pre-World Health Assembly in one word, what would you say?
To me, it's inspiration.
Opportunity.
I would go with empowerment.
Collaboration.
I would say networking and friendship, as you can see. So guys, this concludes our video. I want to tell you to follow everything we're doing here at the World Health Assembly. Follow us on YouTube, not on YouTube, on Twitter at IFMSA, on Instagram at UIFMSA, or on Facebook at International Federation of Medical Students Association. We're going to do another video like that to explain you exactly what we did here as advocacy work at the World Health Assembly. And to conclude, I would like to tell you good morning, good day, good evening, or good night from wherever you are in the world from here in Geneva. Bye guys.
Bye.